Right. Good afternoon, everybody. Welcome to the Ambulance Service Update webinar. We're going to give it a couple more minutes to see if we can get some folks to trickle in here. Just to let you know, we're recording this meeting to put on the web later, just so you know that it's being recorded and transcribed. And we'll get started in just a second here. All right, I think we will get started here. Good afternoon, everyone. Welcome to our Ambulance Service Update webinar. I'm Charles Souchere. I'm the Deputy Director of Ambulance Services. I'll be leading you through most of our update here today. You'll notice we're using the webinar feature in Teams, and so your cameras and mics have been muted. If you have a question, you can use either the Q&A interface that's available in Teams or the chat feature. We'll be monitoring those, so feel free to type in a question if you have one. And we'll leave some time for questions at the end as well. And so we'll get started here. We're going to go over a few things today that have changed with the last legislative session, as well as just some other updates that you can be aware of. We're going to review the education reimbursement program and what's going to be required for those applications, who's eligible, et cetera. There were some changes. That was used to be known as the Volunteer Education Reimbursement program, is now not limited only to people that qualify as volunteers, and we'll get into those details. We'll also go over some changes to Minnesota Rule 4690-8300. Those are your BLS medication variances. And then we'll touch on a couple other reminders, the cost collection survey and the new Earn While You Learn grant program. All right, so diving into the education reimbursement. So who's going to be eligible for this? So it used to be with the volunteer education program that the individual had to qualify as a volunteer under state statute. So that was under that certain dollar amount every year. That has changed, and now any ambulance service that responds to 5,000 or fewer calls in the last calendar year, they are now eligible to seek reimbursement for their EMT initial and refresher. Another new feature is that EMR initial and refresher courses have now also been added to available or qualifying education that can be reimbursed. However, for those EMR and initial and refresher courses, those all have to be completed after July 1st, 2025 in order to qualify for reimbursement. And as a reminder, all of that education, whether for EMT or EMR, it needs to be completed through an Office of EMS approved education program here in Minnesota. To get into some of the details about what you need to apply or what the new application process is going to look like, I'm going to throw it over to Holly Jacobs, one of our EMS specialists.
All right, good afternoon, everybody. So I want to talk a little bit about our e-license system and what you need, because we have taken the volunteer education reimbursement program away from the paper application. Most of you will appreciate that, as you no longer will have to fill out an application for each individual. You will fill this out based on your ambulance service roster in the e-license system. As required in statute, as Charlie said, Minnesota, well, I should back up a second. Minnesota approved education programs, as required in statute, have to register their courses with the Office of EMS prior to the start of a course. When they do so, the office assigns them a course number, and those course numbers contain the year that the course was approved, the education program number, and a 5 to 6 digit unique identifier as to that course number. That unique identifier is going to need to be on the receipt that your agency receives from the education programs to help you identify the courses that you will choose from in the drop-down menus in the volunteer education reimbursement application. Our education programs had a webinar earlier in the week about all this information, and so hopefully we can work with them to get them to comply and help you be successful. Next slide, Charlie. As we said earlier, there are 2 applications. There is one for the initial. This is for initial applicants, and that is to still be completed 1 year after they have been credentialed in the state of Minnesota. And then there is the renewal application that should not be submitted until applications have been completely recertified. So if you're submitting an application for somebody who expires this year in 2026, submit their reimbursement application or your roster after all of your folks have been renewed in 2026. Those applications, you are going to have to upload your receipt for payment, and that application is going to need to include the course number. You will also need your SWIFT identification number for payment from the state of Minnesota. We do have SWIFT vendor numbers for most of you from your cost collection surveys, but be sure that you do know what your entity's SWIFT vendor number is. So as I discussed, the education programs are going to give you that receipt. You're going to log into eLicense. You're going to find the renewal education reimbursement or the initial education reimbursement application is in the screenshot below. And then it's fairly simple, looking at the demographics of your ambulance service. And then the next section is your ambulance service roster. You'll select, your individual who was in the course, and then you will select the course number and you will select the amount that you're seeking reimbursement for. It's really important, and I can't stress enough, that you wait that full year for initial education reimbursement applications, and you wait until your folks are recertified. These are 2 steps in the auditing process that we can deny an application. And once an individual has been selected in a course, they cannot be selected again. And that creates some complications for seeking reimbursement if we do so too early. Next slide, please. I'm not caught up to 6. Are you on slide 6 for the group?
I have. Yeah, I've advanced. Yeah.
Oh, okay. All right. It's not showing up on my screen, but that's okay. Slide 6 should show a copy of the receipt for payment. And we just put an example in here. And so there we go. The receipt needs to include the course number, full courses versus modular courses. So some of you will receive your education, we'll say 4, 5, 6 times a year from an education program, and they may bill you individually according to that. And there may be a different course number for each one of those modules. Okay. Some of you receive modular education and you just get one big bill at the end. So it'll be very critical to pay attention to, if you have multiple course numbers, you need to select an individual multiple times on your course roster, and each one of the course numbers you're seeking reimbursement. If you receive it in a modular method and you get one bill, then you just need to select them one time. If you receive your education in a modular method and you're filling this out for the first time, certainly feel free to reach out to our office and we will walk you through those steps. If you have folks who complete a 24-hour refresher, that is obviously just one course, and you would look at your receipt. And again, this is just a sample receipt, but this same example was provided to our education programs. If you are an ambulance service and you are also an education program, you do need to invoice yourself if you're looking to seek reimbursement, and that will have to be for only actual costs incurred. So textbooks, how you paid your instructors, and perhaps how you paid your individuals for completing the education. But if you're paying your individuals for completing education, that will also have to include a copy of any paycheck stubs that you have paid your folks on your roster for that. So again, only actual costs incurred. If a student does not meet the maximum cost for reimbursement, then you can claim things like mileage and so on and so forth as well. But again, it all needs to include a paycheck stub. And I can stop there to see if there's any questions about this process.
Thanks, Holly. Yeah, if anybody has any questions, feel free to use either the chat interface or the Q&A panel to initiate a question. We'll just give you guys a couple seconds here in case anything pops. All right.
There are no
Seeing
questions
none.
currently, so I guess we can continue.
Excellent. All right, so that covers our education program update. Please reach out to us if you have questions at all. And we did get one that just popped in here. So course numbers seem to be hard to get from the college we use. Any help with that? They're really going to be your best bet, and they have also received instructions on what the course number is and how they should be providing it to you guys. I think in a worst case scenario, if they're not sure where their course number is or something like that, direct them to us and we can help them locate that course number, that as it's listed in our system. And then I'll just pause just in case we have any other questions. Just a few more seconds.
I would add that we have worked with some of the education programs who are not understanding, specifically the colleges and universities who may have a course number for their enrollment that their college or university uses versus the course number from the Office of EMS. And so helping them understand, obviously, the difference between the two and what the ambulance service needs.
Yeah, so they need the Office of EMS course number is the one that is going to be important for you guys to get. All right. Okay, moving on to this is just some general reminders here. The Office of EMS is no longer accepting education provided under the NCCP's 2016 model. So that has been retired. And the NREMT has introduced their 2025 model. And so in order to refresh using that NCCP model, there are new hourly requirements for each of the topic areas. The overall total number of hours hasn't changed, but the distribution in those NCCR hours has. So that's just for your awareness. Or if you're teaching, you can go to the nremt.org website to get additional information about what that hour breakdown is. Another update regarding renewal, we now have one application that is for all levels. Before we had separated EMR out from some of the other levels. And if you were community paramedic, that had an additional step to take. This is all one application now. And it's called the EMS Provider Renewal Application. So that should hopefully streamline things and make things a little more easy. It's all based on the person's certification level, and it should prompt them to enter, the specific kind of education that they need in order to renew, all in one application. Grace periods. After the last legislative session, they extended the grace period for EMRs to match the rest of the certification levels. So now EMR, EMT, AEMT, and paramedics all have 4-year grace periods during which they can complete their renewal requirements and apply for re-entry. of their expired certification. In addition to that, just as a reminder, the legislature also created a reinstatement program that allowed anyone, any EMT, AEMT, or paramedic that expired in the last 10 years to meet the renewal requirements without having to get their NREMT reinstated. That program is going to close on December 31st, 2025, so at the end of this year. And anybody that qualifies for that program needs to have their education completed and their application submitted to us by the end of the year. The December 31st is a drop dead date. We will not be accepting any late applications after December 31st, 2025. All right. The 2025 cost collection survey is open. You guys should have all received an email with a memo about this. Those will be due on November 21st, 2025. You can access the survey. If you lost that email, you can access the survey by going to the news section of the OEMS homepage at mn.gov/OEMS. You can also always reach out to your specialist and they can connect you with another copy of the memo, which has a link to the survey in it. For our last two updates here, the update to Rule 4690-8300 and the Earn While You Learn grant program. I've got some additional slides here, so we'll move on past this slide to our next topic, which is going to be the BLS medication variance rule. So we have updated this administrative rule with some additional routes of administration for the variance medications. So the new rule allows for intranasal or intramuscular pre-measured epinephrine. Glucagon has added an intranasal route for pre-measured glucagon. And the new rule also allows BLS services to administer anticholinergic medications in their inhalers or nebulizers. So this would be like a duo-neb of albuterol. You can still do the albuterol, but you can do it with or without an anticholinergic. So that would be like Atrovent or the generic name ipratropium bromide. That's an anticholinergic. That's what's in a duo-neb. If your medical director wants you or is allowing you guys to administer duo-nebs, you can now do that at the BLS level if you have the variant. And there were no changes to sublingual nitro, that remained sublingual. So what are there any requirements or what do you guys need to do regarding this rule change? Services that currently have a variance for these medications, your license will be updated to reflect the new routes of administration. And there's nothing additional that you need to do. Well, I'm sorry, there's not nothing, but you don't need to make any specific application to take advantage of these variances if you've already been granted them. What you should do if you are already operating with the variances is review your protocols with your medical director to ensure that if you want to take advantage of any of these new routes, that those are written into your protocols. Ensure that all personnel have completed training and skills verifications related to any changes in your protocols, and you'll have to get new signatures and new training rosters to document that training. That'll be part of your annual training now to get those new routes of administration. And at the end here, update your annual medical director skill verification form and medical director statement forms as appropriate to take advantage of to document these new variances. Like I said, you don't need to submit, if you already have variances, you don't need to submit for new ones. We will update the language on your license. You can review which variances are granted to you in your e-license portal. And if you want to add any of these medications or don't currently have variance permission to use the variance medications and you would like it, contact your EMS specialist and they can work with you to complete the application to get the variances applied to your license. All right. just pause for some questions there before moving on. It looks like we did have another one come in. Is the cost collection survey optional to complete? It is not. There's a Minnesota statute that requires that we collect that cost collection information from our licensed ambulance services. So that is a required report to complete. All right, and moving on to our Earn While You Learn grant. So this is a new program the legislature created last session. They allocated $2 million to help ambulance services hire and train new EMTs. The funding, these grant funds can be used to pay to cover the cost of employment, tuition, uniforms, books, etc., wages, while a candidate works on their EMT certification. This is going to be a competitive grant process, and so there is an application that needs to be completed. Additional information can be found on this is also known as and I'm going to get this acronym wrong, so I apologize. It's going to be the Ambulance Service Training and Staffing Grant page. You can find that on our website under the Ambulance Services section. And if you have any questions about it, you can send an email to finance.oems@state.mn.us. Some important things to remember: the applications are now open. Information on the application process is posted on our website on that ASTNS grant page. Some upcoming dates you'll be interested in. We're going to have a grant applicant conference to help answer any questions, provide any feedback on that application. That's going to be Monday, October 6th at 1 p.m. You can sign up for that on the website. Any written questions you might have, those will be due October 8th by 12 p.m. And then we will post written responses to those questions on the website. And the application deadline is Friday, October 17th. The application has to be submitted using our online form, and you access that through the grant page on our website. Last couple of things, these are state required things. The pre-award risk assessment, we'll complete that in November. And then any award notifications and the grant executions will be sent out in December 2025. All right. I'm going to move ahead to the questions. I see another one came in. I'm just going to move to the question slide just as a placeholder here. But the question that came in was, can this be used to upgrade an EMR to an EMT? And the answer is yes. So the grant covers up to certification as an EMT or until that candidate abandons attempts to get certified. So that can pay for someone to work for the ambulance service in sort of either a driver role, or once they earn their EMR, they can work in their EMR role as they pursue their EMT certification. And that's what that grant money can be used towards. And that sort of plan and budget is all part of that application process. So what I think I can do now, and I tried to do this at the education program update, I am going to allow your mics to come on. And so if you guys have any questions and you would rather come off mute to ask your questions, we'll leave some time here for that. So I'm going to activate your mics. If you'd like to come off mute and ask a question, feel free. Otherwise, you can type in the chat or the QA interface, but we'll just leave some time here for questions. I feel like I should have a Tonight Show band or something to vamp while we wait for questions. And so here's a question, Holly, you might be able to ask. Can you submit the education reimbursement annually? So if you have staff on different cycles?
Yes, so I would submit the reimbursement for your staff after they renew. So if you have somebody who is due for renewal in 26, submit for your 26 folks who renew that have a 28, get that 28 expiration date. And then if those folks, your other half of your folks expire in 27, when they get their 29 expiration date, then submit that in 27, if that makes sense. They just have to be renewed before you submit them for reimbursement.
I got a hand raised. Go ahead, Megan.
Hi, I have a question about the reimbursement as well. Since it's no longer volunteer, is there any limit about how far back you can go? Is 2024, even though the rule didn't change until technically 2025? When can you actually submit for that not being a volunteer? Just meeting the run volume requirement.
So the run volume requirement specifically has to be 5,000 runs or fewer in the last calendar year. So that would qualify you for the program. And so I would say I would have to double check this with Dylan. You know what? I'm not going to answer. Let me double check that, Megan, and I'll get back to you.
Sure. Thank you so much.
I will say typically that kind of stuff only goes back until when the program started. It's not typically retroactive unless it specifically states in statute that it's retroactive. But I'll clarify.
Thank you.
And another question, is the 5,000 run for each license or each service as a whole? It's going to be per license. So I know some services that have multiple licenses. If you have a particular license that runs fewer than 5,000 calls, we'll take that individual license versus like the aggregate of the entire company. And then Holly, we got another application type question. So I have staff that refreshed this past February, but are not due until 2026. Do I still submit these people online using the new form?
Yes. So if they completed their refresher this last February and they're not due until 2026, it would be in your best interest to wait until they have received their renewal application, or they've received a new renewal date, but their applications are open to them now to apply. So if they can go in and fill out a renewal application now, and as soon as they receive that new expiration date, I'm sorry, it's Friday, and then you could submit that reimbursement application. Absolutely.
Great questions. Okay. All right. Well, thank you, everyone. That was short and sweet, but we thank you for coming in and seeing the update. If you want to be able to refer back to anything for reference, we will post this to our website under webinars, and so that can be there for you to review. Or you can, if somebody who wanted the information wasn't able to be here today, you can share that link with them, and they can view this online. So thanks, everybody. Enjoy the rest of your Friday, and thanks for coming. Bye-bye.